Well, I got me a lupus shirt, but you can never see my words.
Oh, okay. That's nice.
Yeah. Fisher, your hair is purple. Oh.
Yeah, I got a whole 3 pages that I refuse to read today.
Oh.
She looks very familiar to me.
She looks like Miss Cynthia. They look like twins.
Oh, man.
But let me go get me some tissue real quick, though, because I already know what time it is. Many of you know the month of May is Lupus Awareness. So today we want to pay tribute to all of our lupus warriors out there. So we want to have a conversation about lupus. You know, you often hear that someone has lupus, but what does that really mean? What is their day-to-day life like for a person that has lupus? So let's just talk about it. So for lupus, it is a chronic autoimmune disorder. There is no cure for lupus. And it can be very life-threatening. So basically behind lupus is for a normal person with a healthy immune system, their body produces proteins called antibodies. And these antibodies help fight off viruses, bacteria, or whatever those foreign invaders are. But for someone that has lupus, their body can't tell the difference between those foreign invaders and healthy tissue. So it produces what we call autoantibodies, and auto meaning self. And so basically what's happening is the body is kind of attacking itself. And because of that, you know, you can experience inflammation all over different parts of your body, joints, organ damage. It can affect any organ, lungs, heart, kidney is a big one. And so that's pretty much the background of what lupus is. And so people suffer. There's about 1.5 million Americans that suffer from lupus. And we know that it primarily affects women, typically in the childbearing ages between somewhere 15 to 45 years of age. However, it can affect men and children. So lupus, like I said, is very life-threatening. There's different types of lupus. So the more common one that you may hear of is you may see a symbol SLE, which is systemic lupus erythematosus. So systemic, of course, if you're medical, systemic means your whole body. It can affect your whole body, any organ, anything. That's one type, the more common. There's also a cutaneous lupus, which affects primarily your skin. And so with that, you've probably heard of people with lupus having a butterfly rash, typically across their cheeks. And so that butterfly rash, that's where we get the symbol for lupus, a butterfly. You can't see my shirt, but again, the butterfly, that's the significance behind that. So that's another form. And then thirdly, there is a drug-induced lupus. And so there are certain medications or prescription drugs that can actually mimic lupus symptoms. But typically, once you're off those medications for some time, those symptoms will subside. And then lastly, there's a neonatal lupus. So this is rare, but it can develop in an infant of a mom who has lupus. Okay. So pretty much that's just a little background behind lupus, but we have these amazing warriors today who would tell us more about what they experience every single day living with lupus. And I have to say, y'all know how I get emotional. This will be an emotional one for me because as many of you know, I too am a lupus warrior. So I'm actually going to take a back seat today and I'm going to be one of the special guests. So that's different for me. But anyway, thank you all for joining and I'm very excited and let's dig into lupus.
Absolutely. Well, thank you, Yannick. So with us today on Annie's Girls, we have Miss Cynthia Harvey, who is a lupus warrior. We also have Maisha Harvey, who happens to be Cynthia's daughter. But not only that, she is also a nurse practitioner, and she also donated her kidney to her mother, Cynthia. And then we also have Keisha Coate. So Keisha is a dear family member of mine on my husband's side. So she is also a lupus warrior. And then last but not least, of course, you already heard Yannick mention herself being a lupus warrior today. So I would like to go ahead and switch it over to Kim.
Miss Cynthia, you're the first one I'm going to ask, and then we'll go ahead with Lakeisha and then Yannick. But how long have you been diagnosed with lupus, and what symptoms did you experience initially? Miss Cynthia?
Okay. Well, it's been about 39 years. I was first diagnosed somewhere around 1982. Aisha wasn't born. I had just moved back to Georgia. My husband and I, we lived in New Jersey. So we moved back south, you know, getting ready to start a family. And I started gaining weight. Probably I've been here maybe about 6 months. And so I started gaining weight. So I thought that was great because I'm back in the South. I'm eating right. I'm eating all this food my sister-in-law is cooking. But that was not that wasn't the answer. I started having swelling on my legs. You know, initially now I'm thinking I'm gaining weight, but actually you soon realize your ankles are swollen. So someone said, you need to go get that checked out. So I went to a doctor, and the first thing they said that I suspect that you have lupus. I had never heard of lupus. And so we're talking about 1982. Never heard of it. So he referred me to rheumatologists, and I think they recommended doing a biopsy. At that time, you couldn't really diagnose lupus. It was a long process. It took years to diagnose. I think now they do it a little quicker. So maybe about that next year, they kind of suspected it, and they told me not to have kids. And, you know, you may have kids. If you have kids, you may not live to, you know, throughout the pregnancy, because this was the early part of my experience with lupus. So prior to getting pregnant, they did confirm I have it. Then they just told me I'd be high risk, referred me to a doctor that monitored people with lupus. And from there, you know, everything went pretty much okay. So that was in 83 when Maisha was born.
Wow. Okay. I'm sorry if I'm getting a little teary-eyed or whatever, but that's interesting that you knew way back into 82, because like you said, nobody had ever heard of lupus, and neither, you know, it wasn't until I think my cousin Yannick, you know, that was my first time ever hearing about it, what lupus was. Okay. Miss Lakeisha, the same question for you.
So I initially didn't have what you call so much symptoms. May of this year makes 21 years for me. I initially got sick my freshman year of college. And then I went home, I think around Thanksgiving, they thought I had the flu. I go back, I was feeling okay. December, I still kind of felt the same way. But when I went home for Christmas, I had pneumonia. And so throughout my Christmas break, I stayed sick off and on, going back and forth to the doctor. You know, in January, it's time to go back to school. And particularly, I think maybe the second week into that semester, my roommate noticed that I had moved in about 2 days. And so they took me to the emergency room, which was Huntsville Hospital. And then that's when we found out that I had bilateral pneumonia. And so once again, I had to call mom again. It's like, oh, you got to come back and get me from school. Now they say I have bilateral pneumonia. When my body couldn't shake it, we never knew why. My mama worked for some physicians called neurology associates. And one of the doctors told her that they needed to put me in the hospital. And from then, that's when he initiated them to run specialty tests. And for about 2 years of being a guinea pig, I finally got a diagnosis in May of 2000 that I had lupus.
Wow. Okay. Whew, okay. I'm trying my best not to get teary-eyed or whatever, because I mean, you all are telling very touchy stories or whatever. Okay, Yannick.
You would do that right before me. I'm just kidding. For me, so I've been diagnosed with lupus. I've had lupus for 23 years. I was actually in college, but I came home for the summer and I worked as an intern for a large corporation. And I worked in an area where I had to dress up. I had to wear heels every day and, business attire. And so every day when I would come home, I would notice, like Cynthia said, my ankles were swelling, my feet, my ankles and my knees. And I thought it was because I wore those heels all day. I just kept saying, oh, Lord, I need to change my shoes. I just kept putting it off, thinking it was something else until it just kept getting worse and worse. And then I started, becoming more achy. So I went to the doctor. And of course, this was my primary care doctor. They ran numerous tests on me. And finally, when the results came back, he said, I need you to come into the office so we can talk about your results. And of course, I'm scared because I'm like, what is this? And then when I got there, he said, you have lupus. And I was like, oh, okay, like no big deal, because I didn't know what that meant. I just knew you said I have lupus. And so he kind of got on to me because he was like, no, young lady, lupus is serious. And I'm like, okay, what do I need to do? Again, I don't know. And so he referred me, of course, to a rheumatologist. And like Cynthia mentioned before, and as well as Lakeisha, it's hard to diagnose. They're going by these ANA markers and all these things, but there are multiple things that will make up a lupus diagnosis. It's not just one thing. So I went to one rheumatologist. They tried to put me on certain medications. And one doctor said, no, I don't think you have lupus. I just think you have arthritis. And so that went back and forth for a long time. And then now my doctor, rheumatologist in Atlanta, she pretty much did what we call an AVICE test. So now they have very advanced diagnostic tests. And the AVICE test was pretty spot on. It told her exactly. She actually said you have mixed connective tissue disorder, which consists of lupus, arthritis, and Sjogren's. And typically, I hate to go on, but typically someone with lupus or an autoimmune disorder, you typically don't have just one. They come multiple, usually. It's not just one autoimmune disorder. So that's how I was diagnosed. And it's been 23 years, and we still pushing. So yeah.
That's good. That's all that matters. You're still pushing or whatever. However, I know it had been that long ago. Gosh, that's amazing. But I'm going to go ahead and move on to the next question. We know that genetics is sometimes a contributing factor for lupus. Is there anyone else in your family with lupus, Miss Cynthia?
I do have a niece that was diagnosed maybe about 10 years ago. She's 35, and most of her problems are aching bones, and she kind of had a severe in comparison to me because she was out of work a lot on leave, a lot of aches and pains, and anybody older than me that have passed, I don't know, because somebody may have had it, and I'm speaking on my father's side as well as my mother's side, not sure, because they could have had it because a lot of them had aching bones and things like that, but things they went undiagnosed, so I don't know. Other than her.
Okay, I'm sitting here thinking, oh wow, I have aching bones too, or whatever. So, is that something? I don't know if there's one symptom or one thing that you all would say. Well, you might the lupus check or whatever. Well, okay. The same question for Miss Lakeisha.
On my daddy's side, we don't know. Most of his sisters and brothers only living is 2, and they don't. On my mom's side, we would say my grandmama's sisters. And so before me and my diagnosis, and I'm been kind of open with it, that's when I was able to find out that she had sisters. One did pass when I was a younger child, but we never knew about it. And then she has living sisters. So that's the only people that I know is her sisters. Nobody else has it.
Really? Okay. Yannick?
For me, I don't know about my father's side, but my mother's side, yes, I have a cousin. She's my second cousin. And I also have a great aunt who has lupus as well. And, you know, like Cynthia mentioned, probably others, because arthritis runs heavily in my family. So more than likely, they probably connected lupus, arthritis, but they just didn't know. Even my great grandmother was in a wheelchair for as long as I was alive. And so who knows? But definitely, I have a cousin and a great aunt.
Gotcha. Well, you know, we know that it's so important to share that medical history. You know, as mentioned, there are family members that we didn't know that they had aches and pains all their lives and may have gone misdiagnosed as well. So the next question, of course, once again, starting with you, Miss Cynthia, we often hear of what, you know, lupus flare-ups. How do you know when you're having a flare-up from just being maybe just a little, just regularly sick? Are there any specific symptoms that you feel that come about? And do you feel like there's something specifically that triggers your lupus flare-ups?
Well, for me, my lupus I would say for the most part has been mild throughout my 39 years, other than the attack on the kidneys. In the early years, I can associate it when Maisha was much younger. There were a lot of flare-ups, and I don't remember what brought it about. You know, that was the beginning of the arthritis, and you know, just ongoing pain all the time. And I used to have her walking on my back when she was little to help with the pain. I mean, I was taking all type of steroids, and I can also remember I had problems with my eyes. And they said that was related to lupus. And later on, Maisha had problems with her eyes. So we had to have, I think she's been tested twice to see if she had lupus when she was younger. And then they tested her when, you know, right around the transplant time. As far as flare-ups, I would say in the last 20 years that I had to go to the doctor, none. None whatsoever. Now, I have times when if there's a lot of stress or extreme exhaustion and things like that, if I don't get somewhere and rest, mostly take a nap. I take a lot of naps. And then if not, I'm going to start aching. I'm going to bring on all the aches and pain, and then it's going to last for a couple of days. So I don't have any flare-ups that I know of, you know. Yeah, not in the last 20 years.
Okay. Well, being Yannick's sister, you talked about those naps, so I'm sure she'll probably elaborate a little bit on that too. Growing up together. Keisha, what about yourself? You know, what do you feel like is your onset for flare-ups, if you have any?
When I first got diagnosed, I didn't have flares. After pregnancy, that's when I saw more of the flares, but my number one trigger is always going to be stress. So I hold in most of my stuff, and so holding it in and not letting it out is really stressful. And so I kind of found ways to have to deal with that. But after pregnancy, I can say that's when I have the most issues. Most of the times I can kind of tell, now since I cut my hair, like if I feel my head, it's like, ooh, I'm hot. And I ask my nurse, like, do I feel hot to you? I can say that may be like the onset of a flare, but most times I kind of go in my little space like, okay, girl, get yourself together now. And for the most part, no major flares, but after pregnancy and the, hormone unbalance is the only time that I really, really experienced it. And then I had to go through the whole episode of trying to find the right medication to make the lupus not as active as it was, because the current medication wasn't working anymore.
Gotcha. And Yannick, what about yourself?
So for me, like y'all mentioned, the naps are a must for me. But how I know I'm having a flare-up, I'm more tired than my typical nap. So for example, I remember when I was driving to work, this was probably sometime last year, and I only worked 9 miles from my house. I could barely make it home. I was so sleepy. And I was like, this is not normal. You know, when I say extreme fatigue, for example, I can take a nap and sleep, not a nap, I'm sorry. I can go to bed. Let's say if I go to bed and I can sleep for 8 or 9 hours and I'll wake up, because I usually wear a Fitbit at night. I'll wake up and I'm exhausted. I'm like, oh my gosh, I'm so sleepy. How many hours did I get? 2 or 3? Yeah. The doggone Fitbit say I slept 9 hours. And I'm like, you know, so I can sleep all night and I'm still tired. That's one of my main ones. Sometimes I will get like a low-grade fever or chills. I think recently when I was in Alabama with family, I was kind of having a little flare up and I'm like, y'all aren't cold? And they're like, no. And I literally have like 4 blankets on top of me. So just sometimes fever, chills, the joint aches and all of that. I don't have that as much now as I did when I first was diagnosed. And I think part of that has to do with me. Well, I'm a nurse. And so during that time, I was working heavily on the floor, 12-hour shifts. And so my body would just ache. So now, of course, I'm doing more remote work. So it's not, you know, as strenuous on my body, but that's typical of signs for me. But I feel like as I've gotten older, the symptoms are getting worse. So now I get inflammation in my eyes or my face swells. As you'll see, my eyes are swollen now. And I said, maybe I should wear my glasses today so that you can't see my puffy eyes. And then I said, but they need to know, they need to see. So as much as I can cover up with concealer and or whatever, like they're puffy and it is what it is. And I've taken, you know, my allergist says, just keep taking Zyrtec, keep doing this and nothing is helping. So it is what it is, but that's just my typical flare-up symptoms. I know I'll go on and on and on. So,
well, I mean, I think that a lot of you all said very similar things. That, you know, the stress, that's one of the main key factors. But we hear that with different medical issues that, you know, stress is a high impact activity that can cause just multiple issues. Yeah. Go ahead, Shalisha.
So we're going to switch gears just a little bit. Cynthia mentioned having an effect on her kidney. And I think in my reading, it said that it starts to attack your organs. It could start to attack your organs at some point. And so we're going to switch gears a little bit and talk to Maisha, who was a kidney donor or is a kidney donor to her mom. And we want to know about your experience. What was that like? What was the process like? What was the decision like in having to do that, knowing that you're going to be with one kidney? How did that process work? So we just want to hear your story.
So my story, I think, well, even our story, because it's not just my only story, me and my mom's story it's a very unique and special story. Just me being her daughter and me being a nurse and nurse practitioner now, I was, you know, pretty cheap. She always kind of kept me in the loop of what was going on. So I was able to go with her to her appointments and was aware that her renal function was worsening. And so since her kidney function was worsening, they were the talks about dialysis and, you know, which helps filter your kidneys when your kidneys go into kidney failure. And at that time, her nephrologist recommended, let's go ahead and start working her up for a transplant, get her on the transplant list while she's determined to get on dialysis. So just going to all of those appointments with her, you know, just kind of going through that process with her, I was kind of very informed and saw the process. We were going to Emory. And at that time, me being a nurse practitioner, well, I was actually in NP school, nurse practitioner school during that process, but having worked for years, it was just very, I think I understood the science. So for me, understanding that medical side, it was no fear. So as soon as she was able to go through her process to get on the list, and then it was okay, now we wait on the match. And they kind of go through that thing of ask family or friends, or, you know, put the word out there that you need a transplant. So I was like, hey, sign me up. I want to be on this thing. And that was an emotional thing because, of course, Cynthia was like, we don't know. What if you have lupus? If you're only going to have one kidney, if it attacks your kidney, you know, you've already been tested once, but maybe we can get tested again. So that was the whole thing. And that was something to really be, you know, to really take into consideration, especially since my mom has it, my first cousin has it, which is our niece. And, you know, so really thinking about that. But So that was a part of the agreement. I get checked for lupus. And as long as I was lupus free, I was donating. Like, it was not up for debate. And the process was actually very, very smooth. So you go through an extensive workup, not to go into a long story, but just as much of a workup that she had to go through. It is lots of blood tests, multiple. You can't just say, I'm here to donate. They have to check all of my tests, everything you can think of. I had lots of blood work to make sure my kidney function was good. You cannot have any other medical problems at all, basically. No high blood pressure, no diabetes. You have to be the epitome of health to donate, because they want to ensure that you don't have anything that can harm that one kidney. Then I had to get multiple images done and make sure, number one, do I have 2 kidneys? That was a question. It was like, well, we need to scan you to make sure you have 2 that you can donate, because, there are a few people that are born with 1 kidney.
Yeah.
And then I had to get additional testing to make sure my kidneys were basically 50-50, because they said if you're going to take 1, and that's when I found out that most kidneys don't necessarily function at 50-50. But I was close. I think I was like, I was close enough to that 50-50 side for them to determine how to proceed. And then once we went through it, we literally went into surgery about the same time together. Once I got approved and everything, because the last step was first step is like blood type. And then once we got through all of that, I found out I was a match, and I go through an extensive process. And if people are just curious, the medical insurance actually covers, the donor. So when people want to go in to be a donor, so my mom's insurance actually covered my entire treatment. So it covers that. So I actually went through the process, and we go into surgery at staggered times. So we went to surgery on the same day, but I went in first. So I start first, and then they start her. And then once they harvest the kidney, they take it take it right over to her in the upper. So we were both on a table at the same time. And they harvest my left kidney. And the process is pretty smooth. No complications or anything from that. My renal function is closely monitored. Well, now I'm out once a year and I get it checked, and everything has been good. No, people ask me questions about, what about your scarring? I actually have a scar that's like a C-section. Didn't have any complications. I have no impact on what I can do. People, like, well, can you drink? Can you do this? Can you do that? I have no, whenever I choose to have children, I can still have children. I can still, I can still drink. There are no limitations to what I can do. It was just literally like a major surgery, and I haven't had any issues. What your body can do with 2 kidneys, your body can do with 1. So it was a very, very smooth process, and I hadn't had any issues. And I'm happy to be a donor. Like, I rep it I love it. And that was
this is just a wealth of information. I was just telling my daughter, I forgot what we were talking about, but I was telling her how amazing our bodies just adjust to things, and how it autocorrects. You don't have 1 kidney, it just says, okay, we're going to do whatever I need to do. So it's just amazing in that sense. And we were also wondering, what advice would you give those who are thinking about being a donor, who may have a family member who's in need? What would you tell them?
I tell them it's the greatest gift you can ever give. That is one thing for me. It's the impact that you're able to help someone just have ease of their life. To me, that was just the thing that drove me. And and of course, they're going to do, the due diligence that they did before. And it was lots of, in addition to all the medical tests, I had to have like therapy. I had to meet with a social worker. They have to make sure that you are in a place emotionally and you have support. They even asked questions like, are you being paid to do this? And I was like, it's my mom. She's not paying me. Come on. But they still are, they still ask those questions. So it's not just you donate and this is it. It was a very rewarding thing. So in order to donate, you have to be of the ultimate health. So they're not even going to let you donate if there's any potential harm to your body. And on top of that, there's other incentive that a lot of people didn't know about to donate. And I didn't find out till afterwards. A lot of jobs, and even in my employer, gave me free time off. Even the state of Georgia, it's actually just like, it's like on a state level, and I think it's federal level as well. They give you time off, paid leave to donate. And even in the state of Georgia, it is a tax deduction to donate your kidney. I didn't know that, up to $10,000 of a tax credit to donate as well. So there's a lot of incentive that they are trying to do. Not that I didn't know about any of that till after I was well into, I think I'd already donated once I found out. But there are things that they're due. So that's not a big driver. That's just a little added perk. But for me, the only advice I'll tell somebody is the greatest gift you can ever give. And I have no regrets.
That's wonderful. You know, like you said, second chance at life and second chance at a great quality of life, for sure. So kind of moving back to our warriors, thank you so much, Maisha, for sharing your experience. Just kind of wanted to learn from you all, like as far as your treatment for lupus, how do you manage it? Do you manage it by taking medication every day? I know, like once again, with my sister, that was a big part of it. Or is it diet? You know, what do you do to manage your lupus on a day-to-day basis? Miss Cynthia?
Mine is just medication. The only one that I take, I take two for lupus. Trying to think, lupus transplant. Let me get it right. Hydroxychloroquine. Now, that's lupus. That's issued to me by my rheumatologist. I was seeing him like every 4 months. It was reduced to every 3 months after transplant, and now I think I'm seeing him twice a year.
Mm-hmm.
And he pretty much does the lupus test. I guess what's that, C4 complement or something of that. You nurses may know what I'm talking about. He does that once a year, and just to monitor. Again, no flares or anything. And I go to a what do you call it? Ophthalmologist.
Mm-hmm.
And I go to her at least once a year, sometime twice. And so what she's monitoring is to see if there's any toxicity in my eyes based on the hydroxychloroquine. So, and that's going well too. And then I have the bone density scan. They keep up with that. That's every couple of years. That's for kidney as well as for the rheumatologist. For transplant as well as the rheumatologist. A lot of medicine you're taking for the transplant, it has an effect on your bones. So they kind of monitoring that. So that's for both of them. So diet, I pretty much eat what I want, even though I was advised by my nephrologist to eat less of red meat. I like steaks a lot because I don't eat a lot of like beef, roast beef, and hamburgers and all that kind of stuff. But I do love steaks. So I was just advised to, just eat half a steak when I go out to buy them or something like that. Or even at home, I never eat the full steak. I can eat it, but I don't eat it. So I cut back a lot on red meat and any kind of food that's real heavy on my kidneys. He said the less work on it, less you put on it, less work. Even though I have a new kidney, I have a kidney that's 37 years old or whatever, I still treat it the same way. Nothing special, nothing else special on it.
Okay. And Keisha, what about yourself? How are you managing your lupus?
It's managed by medication. I probably had every treatment option as far as the medication regimen. In the beginning, it was pretty consistent. I only had to take the Plaquenil, and it kept me on prednisone. Now, the prednisone was the only thing that I majorly had an issue with because I went through a lot of weight gain, and it takes forever to get the weight off. But after pregnancy, when I started having a flare, they kind of played around with a variety of medications to try to get the lupus to come back down. And once again, they still put me back on the Plaquenil along with Dapsone. And so with those two, I have been pretty calm for at least about 2.5 years now. And so for me, I see the rheumatologist. I think he just likes to get my copay, but I see him Now it's like every 4 months. In the beginning, when it was a flare, I was going every month, which can be very expensive, especially when your copay is like $60, $70. But for the most part, for his diet, I can pretty much eat anything. But when I was taking the prednisone, I had to make sure that, you know, I stayed away from a lot of the sugary foods, because with high doses of prednisone, you can just gain the weight overnight. And so gaining weight overnight, meaning that I felt like I was tired, I was out of breath, and I only gained it around my mid area. And so to me, it's like I almost had to have a second wardrobe of clothes when I was on prednisone. But for the most part, I like fish and chicken. I don't do a lot of, I don't like steaks like that. So the red meat part is like out for me, and I can't do the pork. So pretty much chicken and fish, and I kind of stay away from like a lot of the rices and pastas, but you know, you got this purge every once in a while. And so for the most part, I kind of manage it. But I do a lot of water, fruits, and vegetables. And so that just keeps me using the restroom quite often, because it's like water being flushed out all day long.
And just a follow-up question for you all, for you two, because I know some lupus patients actually have to do chemotherapy. Has that ever been an option for either one of you?
No, I don't know. I remember prior to getting the transplant, when the numbers were dropping. I think at that point I probably was going every 2 months trying, and we were just watching it. I don't know which way I was going to go. I remember him mentioning something about a drug that he could start me on, and I said, no, I don't want to do that. And I think it had something to do with that, because I remember he was telling me about the loss of hair and, you know, some other things going on that could happen. Then I said, no, I'm going to make a decision real soon. And so I kind of like pushed that off, because I was coming to the point where I was going to have to do something. You know, you're talking about 39 years, and they mentioned my kidney 39 years ago. And I mean, 39 years, you know, like from the very beginning, that was a whole deal that was brought to me. You know, you have kidney problems, you got scarring of your kidneys. But I actually thought I would outlive it, because I was just doing so well. So, you know, I was getting to the point where I was just kind of putting it off, but I was going to the doctor. So, you know, I didn't take that drug. I don't know whether it was chemotherapy. I just remember he was telling me the symptom. It was the same symptoms related to, you know, the things you would take for cancer.
I didn't do the chemotherapy, but was it cell set?
No, because I take that, but I heard that they're giving that to lupus patients now, because my niece takes.
So I actually did a series with the cell set when they was trying to find the right medication to decrease the activity. And so after a while, they gave it to me for my skin, because at that point I had really bad butterfly rashes, and it almost looked as if they were like really pink and reddish, and they hurt. And so I used to get them in my head. And so eventually my hair thinned out from the scarring and the red pigmentation. And so they put me on the cell set for as a therapy. But after a while, I kind of said, I don't feel like this is working. And at that time, the insurance played a role in me having to switch rheumatologists in the middle of that treatment. And so the current rheumatologist now, I kind of talked to him. He was like, well, if you don't feel that it's working, where are other options? And so I tried to do some of the clinical trials, but based off of when they were happening, I would have to come off of the medication. Well, it's already active. And so I was like, why come off the medication for it to get worse, to think, oh, maybe this clinical trial may work and it may not. And so that's when we came up with the other regimens, and then we ended on the dapsone and plaquenil.
Okay. Thank you both for, with answering that follow-up question. And Yannick, as far as your management piece, what does that look like on a day-to-day basis for you?
So going back to the chemotherapy drug, when I was first diagnosed, of course, the plaquenil, the prednisone that Keisha mentioned, and the prednisone came with issues all because of course it also affects your bone density and all of that. Then all of a sudden they were like, well, I've been taking prednisone for so long. Now you got osteoporosis. So we need to put you on Actonel. I was like, no, we're not doing that. And then I actually went to a lupus program yesterday, and this lupus warrior talked to me about vitamins and all of that. So I have it and I want to share it. It's called Rejuvenate, and it's multivitamins. It's a dose pack that you take for 30 days. And she said it has helped her tremendously. And so they have sea moss in it, bladderwrack, which helps for inflammation, burdock root, which is detoxification, turmeric, of course, omega-3. So I'm really excited to start this. You can go on her site, Live, Love, and Juice on Instagram and get more information about it. But I'm trying to do something alternative at this point because I'm really tired of medications causing one issue after another. So.
Oh, this is so good. Thank you for all that information. So, May is also Mental Health Awareness Month. And we know that we're trying to normalize taking care of ourselves mentally. And we wanted to know, how do you guys deal with it mentally? Maisha mentioned that she had to have therapy before she could donate her kidney. What about you guys? How are you mentally dealing with what you have to go through as a lupus warrior?
Wow, mentally. I'm trying not to get emotional, but I hold a lot of it in. And a lot of people don't know how stressful it is, and they don't realize what you go through every day. And I try not to complain, but even as a nurse working on the floor, I would just take care of patients. And when I got home, I was dead beat tired, but I would just kept going. And so mentally, that's a lot to put up with, not to put up, but to take care of others. But it's like, who's supposed to take care of you? I spend half my career taking care of other people. But for me, a lot of times I've masked my symptoms. And I think a lot of people, I may ache, I may be in pain or whatever, but a lot of times you'll never know it because I hold it in, because I don't want people to feel sorry for me. I don't want them to feel like, oh, she can't do this and she can't do that. She has lupus, and I can still do most things, but it's very taxing mentally. And I think just holding that, and people just don't understand. For example, they'll say, every time I turn around, you taking a nap and you this and you that, and people become so judgmental, not knowing what you go through every day. You don't know what kind of day I've had. You don't know if I'm in pain, if I'm stressed, or this one thing you might say may tip me over the edge because I'm so emotional. And I feel like I've become more anxious, the anxiety. And I think a lot of that too is medications. I'm on a lupus support group on Facebook, and a lot of them talk about the anxiety with medications and everything. And I just feel like it's a lot, but I hold it in. I guess that's my way of coping, which is not great. Prayer, of course, prayer. I do have a family support system that's very helpful, and they're very understanding, but at the same time, I don't think they understand the extent of what I deal with every single day. I have a boyfriend, of course. Dating is a whole nother ball game, because it's like, this is how I am. Are you going to be willing to deal with this? That's a lot mentally in itself. Can you accept me? It's easy to say yes, but I don't know. Will I be in a wheelchair in 5 years? I have no idea. You need to mentally prepare yourself if you're going to date me. So I could go on, but again, like I said, prayer, family, and that's really it. That's how I cope.
So I also hold everything in. I'm a quiet person to myself, and so I normally fight through all of my symptoms. I get up early, even if I'm tired, I don't take a day off, I keep it moving. And I'm like, I don't want anybody to feel sympathy for me if I'm having a bad day. Sometimes people simply kind of be like, oh, I'm not dead, I can still do things, and they kind of put you in a bubble. And I don't want to always seem like I'm in a bubble. And so one thing me and my doctor decided that I needed to do with COVID hit was develop my own medical support team. And so even though my family gives me great support and they're always there, I don't share everything with them because I don't want them to feel like they did when I was first diagnosed, like what's going on with there. I don't want to feel like overbearing, like I still want to be able to live and live free, but also kind of like do things on my own. And so what I had to do was choose 3 people that I felt would be the closest for me. And so those 3 people kind of do a mental check on me, like, hey, where you at today? Or we may not talk every day, we may talk once a week, or we may talk every 2 weeks, but they kind of do a check on to see like where I am. I got one, what you working this week? No, you need to take a break. You need to go here, you need to go there. And so they kind of make me come to an understanding of what I'm doing and when I need to sit back and sit down. And so with my new little mental support group people, they kind of keep me on my toes. And also I do a lot of reading, and music is the one thing that I can just plug it in my headphones and just listen, and it kind of makes everything that's around me kind of go away. And so I kind of use music as a coping mechanism, and also trying to make sure like, now how do you be more open when you need to tell people I need help? Because I'm a person, I don't like to ask for help. And so you may be like, Keisha, you want me to do that? I'm like, no, because I'm so used to doing everything on my own. And regardless of how tired I am, I feel like I need to do it on my own.
Wow. I think we all can, probably most of us can say that we do that same thing, and we have to realize, which is holding things in. And we have to realize it's not healthy for us either. My therapist, I have a therapist, and she tells me the same thing. And I say, I hold it in. How is that working for you? She'll say, or I have to do the same thing as what you said, Keisha. Do a mental check. How are you feeling, and what do you need? Every day, how are you feeling right now? What do you need? Whether it's a nap, whether it's some music, whether it's, a chat with a friend, what is it, that little thing that you need? And so letting things out and dealing with those emotions is big for our mental health, as well as whatever else we're dealing with physically, in our bodies. Cynthia, what about you? How do you deal with it mentally?
Well, I can say I've just pretty much learned to just accept it. After living with it and just watching the progress of lupus just kind of go through my life, and I kind of just, especially since I've retired, I'll say that, just learned to live with it. It's because of lupus that all these other things are happening in my life. Just going to the doctor. It looked like I go to the doctor all the time because I got all these different doctors. This one every 3 months, this one every 4 months, this one twice a month. Then I got to go to Emory every month for the rest of my life, the first week of every month, because I have to get a IV as part of that care. And so I've just accepted it. I do have, small times when I, get somewhat depressed, but, I try to get past that and look at the bright side of it. I still can walk. I have a problem with one of my hips, and I should be having a hip replacement, but I told the guy, since I'm not working, I'm not on my feet, and I'm not in any pain anymore, I'm just going to pass on that for right now. So I just try to look at the bright side of it. I deal a lot with fog, which is short memory loss, like don't remember names real quick. I can remember getting off an interstate, and then it all of a sudden it looks brand new to me. Like, which way do I go, to left or right? Then it'll come back. I would say come back like in 30 seconds. So you constantly deal with that, and I've been in the doctor's office, and then I'm looking at the doctor, and I'm like, what is this doctor's name? What is the name? But it'll come back like in 45 seconds, So that's the mental part you deal with. You're like, what if I'm somewhere talking and I just go completely blank, So you just pray that kind of stuff is staying in control. I tell Maisha often, I said, she'll say, you just ask me that. I said, I know, but I need you to answer it again, please, So sometimes she takes me through the rigmarole. Why you don't just write this stuff down? And that's another thing I do. I write down everything. I mean, I got notes everywhere, and I had a problem. This is another mental problem. I had like taking my medicine. I got maybe 7 pills I have to take every day in the morning. And I had a problem trying to remember if I even took the pill. So since I've retired, I just put everything out in the morning, everything out. And if it's sitting on my dresser at 12 o'clock, that meant I didn't take that pill. I might have should have taken it at 10 o'clock. So, you do these little notes everywhere. That's how I deal with that fog system, because I go blank sometimes. I didn't know that lupus affected that. I had one doctor I went to, I went to her just a short time, and she dealt a lot with herbs. And I thought I was going to go to herb and that kind of treatment, still take my medicine. And she was telling me I was just getting older, that some parts of your brain are missing as you get old. But after I started getting a lot of lupus information, and I went to a couple of monthly meetings, like down in Clayton County, then you find out all these different things, people are talking. I'm like, that's what's wrong with me. That's what's wrong with me. And, I'm not getting Alzheimer's, or I'm not getting this, it's not that my part of my brain is getting older and you're deleting things, is what this lady was saying. It's the lupus. So, things like that, I just learned to live with, take a lot of notes, got notes around the house, and as far as like cleaning the house, that's not mental, that's physically. But because I'm tired all the time, and I have a lot of days where I sleep 8 hours and I wake up and it's like I just went to sleep. And I'm just so grateful I'm retired. I don't have to deal with that, just pulling myself out the bed, going to work. So I just try to keep the house clean. I clean up as I go. And, some of my friends, like Michelle and them, I just clean as I go, because I'm not going to have the energy to keep the house clean if I just let everything fall and do this one day cleanup. One day cleanup for me would be like 3 days cleanup, because I can't last, no more than 30 minutes or something. Then I got to go take a nap. I got to sit down. So that's why I've just come to live with it. But you have to remember, I've been living with it for 39 years. And, I saw the progress. I saw me doing good. I saw the times I went down. And I'm just so grateful, to the point where I've gotten that, that I've, I'm not there, but I'm getting there. I'm still alive. I'm still on my feet. I can go to work if I just sort of want to go to work, but I don't want to go to work. So I'm looking at the positive part of it. So I can just recommend, you all are all looking good, and, and there's going to be some downsides, but try to find the good in it, because it can always be worse, because there are some people worse off than we are, a lot.
For sure. I mean, I think that, like you said, that try to look at things with the glass half full, but it is very difficult when you're dealing with lupus on a daily basis. And even with that, I'm quite sure, I mean, knowing from my sister's story, and even, Keisha, and even you, Miss Cynthia, some of the extremely low points, I guess, of your journey, what would you say has been the absolute hardest thing that you've had to deal with during your journey?
The hardest thing, this lupus causing, attacking my kidneys. And then Maisha, wanted to donate her kidney, and she didn't tell you, I didn't want her to donate it. I wanted to go on the list. And I thought about the dialysis, but Maisha said, I want you to have a full life. You're not going to have a full life. I really didn't want her to donate. I wanted to get on the wait list, and she's pretty much talked me into it, but she's looking at the science part. I'm just looking at my child donating a kidney. What if something happened, So after we got past that, And then, after talking to the doctor, and once she decided she was going to donate, we both went separate ways. Like, we could never come up to the Emory at the same time. She went another direction for the people that are donating, and I'm over here for the recipient. And so I would think that was probably about the hardest time, just going through that early transplant thing, because it went smooth and it went very fast for us. So that probably was the most difficult time, watching her go through that. And then, we being in the hospital, she's down the hall, she can't help me and I can't help her, And then when we got home, I couldn't see her, I couldn't help her, and she couldn't see me, and she couldn't help me. So we were separated for a while.
That was hard enough. I definitely, yeah. Every reason for it to be the hardest point. Yeah. I think someone's gonna say something.
Well, I was just gonna add one thing that that on her journey, on this transplant journey, that Cynthia never went on dialysis. And that's one thing that's not mentioned. And that is an extremely rare for someone to basically go. She was in complete, renal failure. And it was at that time that she was getting worked up to start dialysis. Mm-hmm. And so when she talks about going fast, so one thing I do want to commend her on and encourage anybody who ever watches this to stay compliant. We went on that list very, very quickly because she was compliant. She never missed an appointment. And and I know a lot of times people, you may get discouraged, but she went to all of her appointments with her rheumatologist, her nephrologist. She had her mammograms, her routine colonoscopy. So when they say, it's time to get on the list, a lot of times getting on that list takes people a long time because they need to go to all these appointments and get things done. She literally had everything that needed to be done. And then as soon as she was approved, I was approved shortly after because she was compliant. So I do want to commend her on that, because it's a total body health. It's not just I'm only doing this, it's total body health and closely monitoring your body to really try to stay ahead of things. So that's one thing I did want to mention, that process went quickly. So I watched that entire journey, but she, despite, other things she talks about, she may have been sad about certain things, she still kept going. She still continued to take care of her health as best as she could. And this is me watching as her child over those years, so that when that time came, she was already in place because she had already did everything she needed to do because she stayed motivated and put her health first, despite doing everything. So I'm pretty sure that's why her 39 years have been a little different, because she did what she was supposed to do.
Mm-hmm.
For sure. Like you say, you have to be your own advocate, especially dealing in the medical field. Keisha, what do you feel like was the hardest part of your journey?
In the beginning was the hardest because I was a college student freshman. And so now my whole world felt like it got flipped upside down. Now, I think me understanding what it was also played a role from the doctor who gave me my initial diagnosis, because he didn't give me anything of hope. It was always like, you have lupus and there's not a lot of information on it. So, I don't know what to tell you from here. And so for you being like 18 to 20, somebody tell you this, like, okay, am I supposed to die or am I going to die? And so for me, initially, I kind of pushed everybody away from me because I did think I was going to die, but I didn't want people to get close to me and I was going to leave. And so doing that part, I isolated myself from everybody. Eventually, with me having to go through the countless doctors in the beginning, I kind of pushed myself. I did face issues with people saying, oh, she's not going to finish school. She's not going to do this. A lot of discouraging things from people who didn't know my situation. While my family was there, I didn't tell them everything that I was experiencing or what I was feeling, how I felt, or what I was going on internally. But I made it through, I pushed through, and I think once I finally finished my undergrad degree, I kind of got myself together on my own. I did a lot of reading, I did a lot of writing, so most of my writing in undergrad, if I had to turn something in, it was always something related to lupus. And so since my doctor couldn't tell me what I was living with, I kind of had to teach myself what I was living with. to kind of understand what I had to do for myself. And I think my second hardest part was after pregnancy, even though I did everything I was supposed to do, we couldn't figure out why my hair was coming out. And so then I faced the issue of, okay, my hair thinning. I used to wear a lot of hats. I got plenty of hats to go with every outfit that I had for the winter, for the summer. Then it started with the, the wolf markings in the face. And so for me, I felt like my physical changes impacted my journey, even though other people accepted me for who I was and the kind of person I was. I didn't really accept myself. And to me, I felt like I hid behind the hats because they really couldn't see all the damage that lupus had actually did to my face and my skin. And so a lot of times I would wear the makeup or I would just not go out at all. And then I think maybe in 2017, I made up my mind. I was like, okay, lupus cannot be the end of me. And so that's when I made the ultimate decision that I cut my hair off. And so once I started embracing myself, I kind of felt a little better. But with the weight gain, we kind of went back through another mental issue. And once I got that together and kind of decided like, hey, this is me. It's not going to get the best of me. I won't be defeated. I kind of, made myself turn around, like look at the positive side of what I have. And I think in 2018 is when I really became more openly with talking about what I was going through, what I was experiencing, and how it changed my life for the best. And so now I'll be like, why not me? When people are like, oh, did you feel this way? And I was like, why not me? I can share my story to help somebody else who may be just now finding out that they were diagnosed at a younger age, because I knew what it felt like for me at the age of 18 and 20 to be going through a major change, and you felt like you had the support, but you didn't want them to be there because you didn't understand and you was fearful for what you were going to come out with.
Most definitely. Just really good points, like patient advocacy once again, with you saying that you're going to educate yourself on it because you feel like you weren't getting it from your initial doctor who provided that diagnosis. Yannick, what has been the hardest part or parts of your journey?
Hands down for me, I think was the hip replacement. I had a hip replacement in 2013, so I was in my 30s at that time. And, like I mentioned before, the prednisone, I was pretty much bone on bone, no cartilage in between. And so, I remember going to, a surgeon, and he was just like, you're too young. I don't want to do it. And I was like, I can't function. I can't walk. Like something has to give. And again, I had already been on Facebook support groups. There's a group called young lupus patients or young hip replacement patients or something. And I could see other people saying, oh, I was 20, I was 30, I was this. And so I'm like, no, I want it done. And I think it was very difficult for me. I didn't know, because I had some complications afterwards. I had to see a cardiologist, my heart rate was up and all this stuff. But I think just for those that know me, they think, I'm known to be prissy or whatever. So for me to have to use a walker for the first week or so, then I had to use a cane for, about 7 weeks. And most people with hip replacements, your legs are going to be uneven for a while. So mine was uneven for longer than most people. I could literally stand on one leg and swing my other leg. And so I actually had to get a shoe, like add rubber to the shoe, all of this. And I'm like, I don't do this. I'm usually in stilettos. Like, what do you mean I got to get rubber added to my shoe? And, it was a lot to deal with. And, I remember when I was in the hospital, all my nurse friends and stuff came to the hospital, and they bought me a pink cane because of course pink is my favorite color, and the cane was blinged out. They were like, if you got to wear a cane, you're gonna wear a cane. So I was the talk of the doctor's offices with all the old people. They were like, where you get that pink cane from? So I learned to laugh and play, just to take it for what it was. But it was very, very difficult, having to use that cane for a while when I was typically very self-sufficient. And, and kids don't know, I remember my little nieces and nephews and even Bisha kids, they're going to say whatever. I remember one of them said, are you like a grandma or something? Like, why do you have a cane? They were so confused. Like, I'm confused. You're young, but you have a cane, you know.
I think the biggest thing, the biggest takeaway from all three of you all is I have heard how strong you all truly are. So continue with that strength. And like you said, you never know how your story can help the next person that, gets that diagnosis of lupus. Our, last question for you all, and I want to start actually with Maisha, with you being the daughter of a lupus warrior. What type of support do you feel like a family or a friend can provide to someone dealing with lupus?
Okay, I'm gonna give this answer in two parts. So as a child, growing up, not knowing medicine, I feel like my mom just didn't show me a lot of stuff. Like I didn't, and that could be a lot of, like some people talk about, you all have mentioned just being strong, because so she did. There were some things like I knew she had lupus, but my mom was strong. Like I just didn't. So for a while, I did not see a lot of things. Just, I knew she felt bad sometimes. I knew she had joint problems. I remember walking on her back. I remember being gay and stuff all the time, rubbing on the joints. As a kid, I remember having to do that and being supportive with that. But, as a kid, I just, was there and just being supportive. And then once I became a nurse and an NP, I understood things a little bit better. So I was always a lot more encouraging, like, hey, you get to that appointment, you did this, or what's the update on that? Just not being too inquisitive, but just kind of letting her know it's like, whatever you need, I'm here. And sometimes I do get on her about, when she gets the brain fog, but did you write this down? Did you do this? Like, cause I know I'm hard on my mama, but I love her. But she knows that she says she got a lot of notes. I'm like, why didn't you write this down? Like, what's your reminder? So, it is a level of grace because I don't want her to feel like I'm here to hinder. So it's a fine thing. I don't want her to feel like, well, you gotta not baby her, but just, being there. I'm still treating her like, yeah, you my mom, but yeah, you need to get this together. You're going to be stronger. You got to write this down. If you got the brain fog, write it down. Don't just say, oh, I got lupus fog and that's it. It's like, well, how are you going to, stay motivated? How are you going to get ahead of this? You can't just accept it and not, and I don't know if that's the perfect answer, but for me, that's how I've kind of motivated her. It's like, okay, keep pushing, keep moving forward. What's your next step? You got an issue. How you going to fix this? Don't just accept it and sit still. So that's been but that's the medical part of me. I still understand parts of lupus. I understand I'm not going to over push her where she's not able to do certain things. Because the medicine, the medical part of me is like, I know certain things aren't realistic. I know you need to take your naps. I know that when you up at 2 a.m. calling me, it's because you didn't napped all day and now you're wide awake. And, and I get that. And you texted me, so I understand. I don't get on her about that. But there are other parts of me that is like, I get on that brain fog. Take your notes. Don't just say, I forgot it. No, write down your notes. Write down things that you need to do. Make sure you stay on top of yourself. Yeah, I know your joints ache sometimes, but as you're aging, you need to exercise. You still need to do yoga. You still need to stretch. You still need to build muscle. So I try to be that, it's not tough love. It's just, I understand your diagnosis. Part of it is tough love, but I understand your diagnosis. I'm not going to baby you through this. And that's kind of how, like, Keisha and Yannick, you all say your families understand what's going on and you don't want to feel like, everybody's so, oh, woe is me, you can't do anything. So a part of me is just, Mom, you can do this. It may take you a little bit longer to do it. You can do it. You need to find your compromise of how you're going to do it. So that's been my approach as her daughter and as a family member. Just being a family member and being a nurse is do it don't just sit and be sad. Do it how you can do it. That's going to work best for you. So that's my take on that.
Sounds like a little sweet, tough love, maybe. Maybe we just put sweet in
tough love.
I think she said it's not. I was like, what do you say?
Tough love.
It's tough love, but it's my mom. So for me, it's like a personal thing. It's like, it's my mom. I'm like, nope. If nobody else gonna say it to you, I'ma say it to you. Because in the end, you my mama. And I want to make sure you stay as healthy as you can and you taking care of yourself. So you're not gonna just sit in this and give me an excuse.
Hello.
Do it how you can. It's not like you better do it right this moment. It's, well, how can you do it that's gonna work for you? Not do it the second. So like she talks about cleaning the house or doing things. I'm like, okay, if you want to have it really, really clean, you want to do what you need to do. How about we just hire somebody to come in to clean or, you know, you can't, you know, exercise like you want to, then she got a bicycle. And I'm like, okay, at least you're still getting out and exercise. Because in retirement, as you age, you still have to exercise. And you can't just say, I can't exercise. Yeah, you can't go running. No, you can't go walking, but you know that the bikes work for you and your joints, you know? So the medical part of me is I understand that you have to do it at your pace and you can do it. And I know what you look like. I know what your numbers look like. I know how things look. So you can continue to stay motivated, but do it at your own pace. Part of me is like, I'm here and I get it, but you still my mama.
Well, Cynthia, I guess, how can your family provide support? I don't know.
Send me a housekeeper once a month or something.
Oh, yeah.
She has sent a housekeeper in there a couple of times. I just, you know, I just try to keep up. Like I said, I clean as I go. Because I just, you know, try to keep everything in place.
She's her houses don't take that her house is junky or clean, you know, but
No,
sometimes
it's not.
those deep spring cleans where somebody need to get back behind the blinds and get in dust. And I'm like, I know that that's a lot, you know, for anybody and the size of her home. I'm like, let's just bring in a cleaning person to really get a deep cleaner, you know, clean all the baseboards, clean all that stuff. And then you can just do the regular stuff. But that's part of that compromise that I talk about. It's like, don't put this stress on you. Let's just bring somebody in the house.
Mm-hmm. I don't have lupus and I'm considering it, okay?
Yeah.
So, I mean, I guess, would you say, Cynthia, for you, is it just kind of keeping you on track? Would you say that's kind of the support you look for?
That's the kind of support I look for. Yeah, you know, if I could have something like that, even every 3 months would be fine with me, you know. And that's something I'm considering.
Okay, well, good.
Yeah.
Good.
Why not?
Right, why not? I guess
I'll take a housekeeper.
Okay. So what type of support are you seeking from your family and friends, Keisha?
Mostly just doing checkups. I like family. I think COVID hit hard for me because it made it like I was isolated from everyone. Mm-hmm. And due to my condition, everybody was like, oh, no, you can't go over there. And if they did come, it was like very strict of who could come in and out. So I felt like I knew they were there, but the fact that we couldn't see each other, it kind of really played a physical and emotional roller coaster with me during COVID. But I just say the check-ins, hey, what you doing? How is it going? But they could also send me a cleaner.
I know. I think that's one common denominator here. Yannick, what about yourself?
For me, I was actually going to say the opposite of what Maisha says. I was like, for me, I think is people trying to push you, like say, oh, all you need to do is exercise. All you need to do is eat this and do that, you know. But of course, that's her mom. She give her tough love. But for me, people that don't know enough about lupus, that are constantly like, you need to do this and you need to do that. Well, I have a very demanding job, which is part of my stress. So sometimes I may work 10 or 12 hours. That takes everything out of me most times. So by the time I'm done working, I don't have any energy to exercise. So it's like either you find a way to do it early in the morning. Like there's a way, like Maisha said, you can find time and do things, you know, however you need to. But for me, I think it's just not being judgmental or just pushing me to say you should do this or you should do that, just trying to be a little bit more understanding, and which my family is very, very understanding. Like I said, I think that they just don't know the extent. And a lot of times I hide things because I know my mom, everybody knows my mom babies me a little bit, and she'll call and, Nancy, are you okay? You know, so I may not tell her everything. You know, I just say, oh yeah, I'm fine, you know, just because I don't want them to worry, but just continue to just be understanding and supportive as you already have been, you know, so I can't ask for more. I just think for me too, just maybe learning about lupus so that you can have a better understanding. So that's it for me.
I definitely agree. You know, Yannick, you mentioned about telling mom, and, you know, to the audience, that's the thing about it. Sometimes when Yannick will have something going on, she'd be like, don't tell mom, I'm telling you, because I don't want her to get all worked up and all this other stuff. So just know that I'm, you know, I got to go to the doctor for this. because of the different flare-ups, and then because of the lupus, it caused this type of effect. So she's 100% right. And I think, as a sister of a lupus warrior, I think for me, I would say, like you said, people being understanding and providing and giving grace. Because you don't know what it's like to walk a day in that person's shoes. I can't say it's hard because I don't live with it, but I've seen it firsthand on what it is like to be a lupus patient. So thank you all for your story. And yeah, so family and friends gotta listen. I think that's one of the biggest things in education.
Education, yeah.
Mm-hmm.
Yeah, this has certainly provided a lot of insight for me. I was around when Yannick found out about her lupus. She doesn't remember that, but I remember her telling me that, oh yeah, I just came from the doctor and the doctor said it's bad. And, she told me, and again, I had no clue what it was, just like the rest of you. I said, oh, lupus, okay, you got lupus. I'm like, it's not cancer or whatever. So, and that's the other thing about it is because we don't know about it, we're not as gracious. When someone says you have cancer, people are a little bit more gracious to them. You say lupus, it's like, oh, okay, and so I have learned a wealth of information just from us preparing for us to talk about this. We always kind of handle Yannicka with a little bit of care anyway, but I think that it's helped us understand what she goes through and what a lupus warrior goes through. I mean, she is extremely strong. A lot of this I had no clue about. I didn't know she would have all these things until we started talking about this actual recording. And I was like, okay, I had no idea that you did that. And of course, we see her nap all the time and we say, she's taking another nap, she's taking another nap. And I knew she was exhausted and I knew it was partly that, but I really didn't know the extent. And so thank you all so much for educating us. Thank you, Laisha, for just sharing your story and your testimony about being a donor. And we just want everyone to just up their awareness about lupus and show some grace to those that are lupus warriors. So with that said, thank you all for joining us. Thank you to those who are watching Annie's Girls. Make sure you hit the like button, subscribe, and share. We really appreciate it. And we hope to see you again right back here on Annie's Girls. Thanks.
Okay. Bye-bye.
Bye, everybody.